Welcome back to the Self-Care Creative Podcast, the show where I discuss everything from mental health over personal growth to creative struggles. I'm Ray, and I hope you will join me while I go down rabbit holes and interview other creatives on here. Follow and review the podcast to support the show, and let's get into today's episode. Hi. This week I wanted to talk about a topic that has been on my mind on and off for literal months because I see it everywhere and it kind of bothers me. I can't even say kind of. It really, really bothers me. You can read by the title of this episode. It's about exposure therapy, and I'm just gonna try to form this into one sentence, but I really, really, really hate the fact that exposure therapy is kind of considered the standard for all types of anxiety and sometimes even PTSD. At least when you look at the CBT, like cognitive behavioral therapy space, and the online mental health space on like social media. There's so much to talk about here, and it's gonna be a ranty episode if you can't already tell. So if you don't like ranty episodes, you can come back next week because I'm having a lot of emotions going into this. I have my own experiences with exposure therapy because I went to therapy for like cognitive behavioral therapy for my anxiety when I was 15, 16. Yeah, around that age. I've talked to like different therapists throughout the last 7-ish years. And the center of conversation when you have anxiety disorder in therapy is always exposure. And I totally agree, like based on research, exposure helps a lot with anxiety, especially with generalized anxiety and just several types of anxiety. I can absolutely agree that this is like a good type of therapy, but here's the real big problem that I have with this. People that push exposure therapy on people that have anxiety as a diagnosis, never or almost never, I've never come across a good therapist, at least when it comes to exposure therapy, never checks if there's a root issue that is not anxiety. And I'm a big believer in the fact that a lot of anxiety disorders come from trauma, and this is never checked. It's like I've talked to so many people, they never got checked if they have trauma, and if trauma from their childhood or something else is triggering their anxiety disorder. It's always oh yeah, you should face your fear. And as someone that has done that and has then gotten into burnout and then gotten into a big relapse after like a year and a half of doing exposure, I call BS, because if the right thing triggers you again and like your anxiety is actually PTSD related, yeah, exposure therapy like will not do that much. So yeah, I find that's a big problem, because someone with PTSD, for example, needs a lot of safety feelings. Like telling that person to get outside of their safety makes no sense. Like, of course, all PTSD, like people with PTSD also need to like learn to like neutralize their triggers, but it's not the same for everyone with PTSD. Like, so for some people with PTSD, exposure therapy works, right, with their triggers, but that only works after they learned tools to make themselves feel safe. And those tools are a little bit different from tools for generalized anxiety disorder. And other people with PTSD might still not know what is causing their symptoms, and they don't know what their actual trauma that is the root of their PTSD, but they're still not gonna like exposure therapy is not gonna help them. That's my point. Like I know now that the thing that gave me anxiety was a trauma, and that trauma was very easily integrated. I talk about that in my next episode because it's about hypnosis and how hypnosis helps integration for trauma, because it's very similar to EMDR. But yeah, anxiety is also so overdiagnosed currently, especially on women. Like, it's the new hysteria thing. Like, Everyone gets like the diagnosis for this, but nobody, like barely anyone ever looks deeper. You know what I mean? Thankfully, I had one therapist that was actually a psychiatrist that made me look into all my hormones and stuff like that. So I cannot blame anything like that on the healthcare system, thankfully. But as someone that is currently trying to like find someone to assess me for like the potential of having ADHD, I also like learn a lot about ADHD currently. Not only that, the research on it is heavily male centered and children centered, so as a adult woman it's almost impossible to find someone that actually has specialized in it. But also ADHD has a comorbidity in women, especially, that is anxiety. I've never seen a therapist for myself or for any of my friends that checked for anxiety being a comorbid diagnosis for anything else. Whether it be PTSD, ADHD, or autism, like those things rarely get checked for when someone has the diagnosis of anxiety. And I find that incredibly concerning that is not checked in a lot of cases, and the first thought is you should do exposure therapy. I also found a really nice post today that showed like I don't know what you call that in English. But like there's different zones when you have anxiety with facing your fear. Like there was like in the middle is like a green zone, like that's like exact right amount of how much you face your fear, and then left and right were like red zones. And on the one side it was like you don't face fears enough and you change your life around your fears so you don't have to face them, and the other red bar was you face your fears too much and you make yourself feel unsafe and you give yourself burnout. And a lot of times therapists will push you into this overexposure to fear by making you feel like you're underexposing yourself to fear. I have had that happen to me in every single therapy session that I've ever went to. Like don't get me wrong, I still had like good experiences with therapists, of course. Like one of the therapy that I've been in the longest in the past, that was still good, that still helped me. But therapists all over have this thing down of, oh, you don't face your fear enough. And for example, I do school online because school has been a big trigger for me when I had anxiety. And I'm just now uncovering very slowly like all the reasons why that is the case. And I now know this is 100% PTSD. Nobody ever looked for that. You just get the diagnosis, oh yeah, school anxiety. Yeah, but like school anxiety needs to come from somewhere. Like even if you like, an anxiety doesn't develop out of nowhere. And I don't know why so many therapists still practice from that standpoint. Like, yes, anxiety can be stress caused, of course, yes. And in that case, exposure therapy with better coping skills can absolutely help. But most anxiety cases are either something way deeper than anxiety, but even if it's just anxiety, pure exposure will not help. Pure exposure and a couple of coping skills will not work, and I feel like I'm a perfect example of this. I struggled with anxiety for 6 years for it to end up in like not being there anymore after one session of trauma integration. I feel like that says a lot about our healthcare system. And like I'm gonna talk a lot about that a little bit in the next episode about hypnosis and stuff. But yeah, I feel like do you understand what gets me so mad about the standard of exposure therapy? I totally understand the research, and it definitely helped me in like the 6 years that I struggled with anxiety disorder to like not fall back on facing fears, of course. Like I tried to regularly face something that I was afraid of. But often therapy pushes you to do like the really big things, like oh yeah, you should do like the thing that you're really afraid of, and you should do it alone and not with somebody else there, and like face an entire panic attack. And no. That works for a lot of people, yes, but it doesn't work for everyone, and it does not work for people that haven't been checked for deeper stuff. If somebody would have checked me earlier for PTSD, I wouldn't have gone through 6 years of constantly putting myself in unsafe situations from my body and triggering my actual trauma. I don't know, like it's a wonder that I'm not more angry about this. But yeah, I just have a very personal problem with this exposure therapy standard. I don't know. Like it's a really good type of therapy if everything has been cleared. If a therapist that does exposure therapy with their clients has cleared that client of PTSD, ADHD, and like other stuff that causes anxiety, then this is like a really good form of therapy. I agree with that. Like of course there's research on it. But like I said, anxiety in a lot of cases, at least in almost all the cases that I know, has a way deeper problem. Like anxiety is that's coming from our nervous system, right? And with PTSD, for example, there's this model of like hyperarousal and hypoarousal. Like hyperarousal is anxiety, hypoarousal is depression, and in between is the window of tolerance. And I don't know, when I think of anxiety now, looking back, I'm like, I feel like a lot of people with anxiety disorder actually have some kind of trauma that would easily be solved if people that work, like therapists that work with anxiety patients, would actually do body-centered therapies or like methods and trauma integration techniques instead of exposure therapy. I don't know, like exposure therapy should be like one part of the recovery. I can agree to that because it definitely helped me to like face like fears, but on my own accord. Like it never helped me for someone else to pressure me into facing more fears and to judge me into like, oh yeah, you're doing this to like protect yourself from like feeling fear. Because now looking back, that's the most fucked up thing a therapist could have said to me, and they did. Especially like the one therapist that I instantly like dropped. Like I heard like you're building your life around your fear because you do online school. And now looking back, I'm like, I so clearly have PTSD. First of all, how the hell do you not notice that in a patient? Second of all, I needed safety, not exposure in that case, because it clearly like school had something to do with my trauma, right? I mean, I don't want to share a lot about my trauma, but my actual trauma has nothing to do with school, but with a similar like system of school, like that is similar to school. And like I only know that now, of course, but like I needed the safety from that place, and it's like the best decision I would have ever made to like do online school, because why would I unneededly face like a trigger over and over again if it only gives me distress? You know what I mean? Like, and like the only way I could have handled school again would have been with intense trauma integration practices and body-centered practices for trauma. And at the time, since I didn't know it was trauma and nobody ever checked for it, I couldn't do that. Like if my 13, 14, 15-year-old self would have had EMDR, hypnosis, like all the body-centered things or internal family systems, like of course I would have handled school. Nobody ever checked for that. Like that is such a, like how do therapists that have studied this for 10 years, at least in the country that I'm in, you need 10 years to fully be a psychotherapist. How the hell do you look at anxiety patients and the first thing you think about is not checking for trauma? The first response is always, you should face your fear. It's not even that the first response is like that someone should build their coping skills. I mean, that a good therapist will say both. They will be like, we need to build your coping skills and you need to face your fears. And I can kind of get behind that because the combination of those two things can definitely help. But not checking for anything else is such a normalized thing. And that's like in the entire Western world. It's not just like where I live, which is what gets me so mad. Like, yes, exposure, important, but this shouldn't be the center of getting rid of anxiety disorder. It, like, When I look into forums of people with anxiety disorder that have struggled with this for years, I barely see anyone getting tested for PTSD. There are people in these forums that have had anxiety disorder for 10 years and they get still preached upon that exposure therapy will help them, that like taking medication alone will help them, although that's just the band-aid for while you should actually work on anxiety, you know what I mean? Almost none of these people ever get like tested for like PTSD, ADHD, anything that can cause anxiety as like a symptom, more or less. And that blows my mind. It blows my mind that it's so normal. Like it would also make me angry if I would see just a couple instances of it, that people just don't get tested for like PTSD or stuff like that. But yo, especially in women, ADHD, for example, is so underdiagnosed, and anxiety is such a big part of like ADHD in women. And that nobody looks for that either is just like, what are our therapists like trained to do? Like I just recently talked to someone that is getting a degree in psychology, and they, in their entire time until now, and I think that was like 5 semesters, they had like 3 or 4 slides on ADHD in their entire like degree. What? Like, so on one side it's not everything is in the degrees, and on the other side everything else is kind of decided by the therapists themselves if they want to learn something more about a specific mental illness and get an extra certificate in it. I find that weird. I don't know. That's just at least how it is kind of here, like where I live. But what? Like, I read not a lot of books about psychology, but enough for me to be like, if I see someone with anxiety, the first thing I will ever question is if they have trauma. And the fact that people with a 10-year degree do not do that first thing when they see an anxiety patient is just, don't like. Do you understand why I find that weird? Like, it comes so easily to me to be like, huh, you're struggling with intense fear that came out of nowhere, so it must have probably been triggered by something. Sounds like a trauma trigger to me. And of course, it's not always it, but the chance of a generalized anxiety disorder being PTSD is pretty high in my opinion. I mean, PTSD is an anxiety disorder. It's kind of like a spectrum, right? Like, generalized anxiety disorder and PTSD have a lot of overlap, and I feel like that's kind of a spectrum that overlaps heavily, and that nobody that I've ever talked to, or that none of the therapists that I've talked to myself have ever like considered this. That blows my mind. Especially like in my case, I grew up around people that had PTSD, and I've always been open about that to therapists, and that never like caused anyone to be like, yo, let's like look into if you have PTSD. Like, if you don't have instant recollection of like, oh yeah, flashbacks, I have nightmares, therapists often don't care. And this is like, I'm gonna go off on a tangent for a little bit here, but this is exactly why I'm like a proponent of a certain degree of self-diagnosis. Of course, you shouldn't self-diagnose and then tell everyone about it, but I feel like, especially with stuff like that's underdiagnosed, like for example ADHD in women, self-diagnosis is often like the only thing that will actually end up getting you diagnosed after years and years until you finally find a specialist. Yeah, I don't know, I'm a proponent of like self-diagnosis. Of course, not like based on like 1 or 2 self-tests online, but actual like research. And I don't know, there's a very skewed like way people look at self-diagnosis, and they're like, self-diagnosis is bad because blah blah blah, and every time that comes up, I'm just sitting there like, do you understand how under-researched stuff is in women most of the time? Also not everyone has the access to like healthcare for their mental health, so it's like, how are they just supposed to like wait forever until they have a diagnosis before they like type in something online to maybe get a problem solving workbook or something to work with. Like, the thing is, if you self-diagnose, chances are you're pretty close to your actual diagnosis. Sure, there are like a lot of mental illnesses that overlap, but like, if you have some symptoms intensely that overlap for like both things that it could be, then it doesn't really matter for which one you actually read up on stuff, as long as you like get a way to cope with those problems and symptoms that you have. You know what I mean? Like yeah, it can still be problematic because the coping mechanism for one thing could be completely opposite to the other, but you will probably notice which one helps you more, right? For example, PTSD and ADHD overlap a lot, which is why I'm like, I kind of want to get assessed for this. And like, things that help ADHD patients can often help PTSD patients and the other way around. So if someone self-diagnosed with ADHD, even though they have PTSD, or the other way around, they would still be able, through the self-diagnosis, they would be able to get themselves at least some level of help if they don't have a good like healthcare provider or anything like that. I'm also proponent of like self-education about your own illness. Like for PTSD, I read The Body Keeps the Score, which is like kind of a very respected book, I think, in the trauma space, and a lot of trauma survivors read that too. And like, reading that book made me realize how many therapists should actually read that book because yeah, the amount of people around me that I was like, oh, you're like diagnosed with anxiety disorder, generalized anxiety disorder, but like we've talked for a long time. But actually, like, when I think about this, this sounds more like PTSD. And I don't know, like, of course I cannot diagnose friends or anything like that, but like, often these symptoms are so glaring. And like, as someone that is always completely open in therapy, like, I'm not one of those people that wants to like outplay their therapist or be like liked by their therapist. I'm just there to like work on myself and I'm very honest about a lot of stuff. It just blows my mind that you can be like an open book and a therapist will still be like, yep, that's anxiety disorder. And you're just like, I'm looking back and I'm like, I didn't go outside for like months. I mean, I went on like little walks, but like, other than that, I didn't go outside and do new things. Like, I lost out on like the second half of my teenage years because several therapists could not check up for PTSD and kept pushing exposure therapy, which ended up actually being worse for me in some instances. Like, thankfully, I, for myself, found a good middle ground, which is why often explore, like, I already mentioned this earlier, a lot of times, like, therapists will tell you like, form your life around your fear and you should expose yourself more to like stuff, when that's actually not the case, and you're actually going at a good pace for yourself. That just simply takes longer. And this is a good point to like point off that therapists often are simply just like the kind of people that want you to like be part of the working class again, and you know, like, make them more money and shit or whatever. I don't know. This is just let's not talk about that. I feel like a lot of therapists that I've met are just very much, you're just here to like be able to become a person that can work again. And I don't want to know how people feel that are actually mentally disabled and go to therapists like that. Like, that must be awful. But yeah, it's, I don't even know anymore where I was with this. I'm just very disappointed in how ignorant the therapy space is. And like, this is not uncommon. What I'm talking about right now, there are comments after comments after comments in posts everywhere in the mental health space online. This is like not an uncommon thing. I don't know how many times in my life I have read comments and wherever else you can write your story and like YouTube videos where people were like, yo, I actually had like something different the entire time that was so glaringly obvious. And stories about like being pushed into like certain ways of dealing with anxiety or anything else when it was like, when going at the pace that they as the patient were comfortable with, worked the best. Like, I did exposure therapy at my own pace in the 2 years where I couldn't go to therapy because I had just previously finished therapy. And in that time, yes, I could have done more, but going at my own pace made, like, in the end, made more sense. And it also progressed me slow. But like, why is the goal to progress fast? Like, mentally you should feel well enough to be like, oh, today I can like, from based on my mental energy, I can face like a bigger fear, for example. Like, if you don't listen to that inner amount of energy and you just push yourself into it, you surely will burn yourself out. And I feel like this is not calculated in a lot of the times. It's just like, yeah, you should face your fear. Let me tell you, I tried that like in one winter, and I ended in a lot of depression because I was like so burned out from trying over and over again to face like a specific fear. And then I had a panic attack, and then I had another panic attack, and I was like, I'm not doing this again. Like, it's someone that has this, like, has anxiety, they should face that on their own accord, especially if the anxiety comes from PTSD. I feel like this pushy culture from therapists, it's more toxic for people than it helps people. Like, yeah, maybe it helps one patient, but it might not help the other to be like, you should face your fear more. That is like a subconscious like pressure that you're putting on a patient. That also, can I just add that kind of sounds like the pressure that a parent would give to a child, and you don't know if that person has like CPTSD somewhere. Like, there's so many undiagnosed people with CPTSD, and if you don't even check for PTSD in the first place, why would you talk to someone like that anyway? Like, there's like, how the fuck are so many people working in the therapist profession without being trauma informed? That's what my question is. I will never understand this, I swear to God. And even if they're like trauma informed in a lot of cases, then they are like not informed about neurodivergency, like ADHD, autism, that kind of stuff. Like, they overlap so much. Like, PTSD and ADHD at least overlap so much. How the hell are you trauma informed but have no clue about ADHD? Because that's also what bothers me a lot. Just this, oh yeah, we don't listen to lived experiences online. We just look for all the like studies. That's not how this works. Psychology isn't just a dry like field of science. Like, yes, it should be researched and it is a science, but it's also social. So the fact that people, like, that a lot of therapists don't listen to lived experiences of people online, I don't know, like, that strikes me in a very specific way. I don't know, like, I learned more from other people's lived experiences than from therapists. And therapists should include lived experiences way more in their practice, in my opinion. But yeah, I don't know, just the blindness to exposure therapy not working for everybody, and the not checking before putting someone through exposure therapy is just way too common. And exposure therapy is pretty much like synonymous with CBT for an anxiety, someone with anxiety disorder. Like, I know exposure therapy is actually its own therapy, but like, usually like cognitive behavioral therapists will just take that and push it onto like anxiety patients, even though they probably don't have actual training in it. Because I'm pretty sure some, like, the people that actually practice exposure therapy do get taught to check for all these other things that are actually like contraindications for exposure therapy. And since CBT therapists are probably not especially trained, like specifically trained in that, they're just, oh yeah, you need exposure because studies say that, blah 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 blah. But like, studies can only tell you so much of the scope if you don't listen to the lived experiences of people. Like I said, like, for me personally, exposure therapy that I did in my own right helped to a certain degree, but it's not the only thing that helped. Like, it's like a puzzle piece of several things that need to be done to heal anxiety. And I feel like cognitive behavioral therapy is just like, oh, here, I'll throw a couple coping skills at you and then you should do exposure, and that's it. What? I don't know, it blows my mind how obviously traumatized some people are that have anxiety disorder, and how that's not seen by people that are literally trained to be able to see that. Like, I don't know if I'm just an extra empath and I just studied a lot on my own about trauma, but it can't be that like me reading a couple books and being like psychoeducated that I can see some like stuff like that easier than like someone that is having a 10-year degree. And like, I mean, it's not the degree is not the whole 10 years, but like, You know what I mean? To get to the point of like psychotherapist, you need 10 years. I find that very concerning. Like the amount of therapists that like misdiagnose. Like I didn't go into like stuff that I don't personally have, but the amount of people that are misdiagnosed with bipolar or borderline, like those two things, or God, there's so many things that are misdiagnosed. Like it really, like I don't know if this is just my brain being really good at learning new stuff, but like there are not that many very common things like in mental health, right? In the mental health space, like there's anxiety, depression, bipolar, PTSD, ADHD, autism, dissociative identity disorder. There may be 10 to 20 mental illnesses that are like very common, like very very common, that you will come across. Schizophrenia maybe too, and like OCD, like that's also kind of like very common. Like and like learning the traits of each is so important, and but also like recognizing that a lot of these illnesses don't have in-depth research, or the research that exists is like heavily done in like a very specific age group or a very like a specific gender, and that you need to like check for lived experiences online and offline. Like the ADHD space for women. Like first of all, like the fact that there are so many therapists out there that still believe that ADHD is like not being able to concentrate at all. Like so many people I've come across don't even know what hyperfocus is. So like what like they're like if you just live based on research, are you okay? Like you're in a field that is so dependent on lived experiences, and you don't listen. Like women with ADHD are so incredibly dependent on online spaces for ADHD, because that's the only space where they can see, oh, this is a very common diagnostic key thing actually for other women with ADHD. That's like, how can you not be aware of that? Like, or like, I don't know, like bipolar and like borderline, like those things don't have the deepest research in them recently, I feel like. I might be wrong though, but I feel like those are also spaces that would rely so heavily on lived experiences. Like if you only go after a diagnostic key, of course you're going to misdiagnose someone because so many things overlap so heavily. But if you go into actual lived experiences regularly for each of the like 20 to 30 biggest illnesses, you will be able to like at least a little bit see a difference, and you will see less of a stereotype per illness. Like for example, schizophrenia usually has like a stereotype. Autism, God, I don't know how many times I've seen comments of autistic people that said like, oh, at first I wasn't able to be diagnosed because I could hold eye contact. Like that is such a stereotype, and if people that diagnose stuff like this would actually read up on lived experiences, they would stop like diagnosing based or not diagnosing based on a stereotype. Like lived experiences are like so essential to this entire field, and I don't get why this is like not more normal. Like the fact that like you can sense if a therapist is only going based on diagnostic key, and like congratulations, I can also open Google, open up the ICD or the DSM, like it depends where you are, and I can like go through all the diagnostic things, and I can be like, yo, I do most of these. Like, come on. Like, we can all do that at home too. And like, obviously you're trained a little bit different through like your degree and how to like handle like this diagnostic key and for what else to look in patients. But like, if you leave out lived experience, you will misdiagnose so many people. You will treat many people wrong because something might not work for them because they just have a different like upbringing or something like that. So many people that got a degree in psychology, psychotherapy, wonder why so many people even trust holistic therapists, because especially where I live, holistic therapists don't even have a certain set of like schooling that they have to go through. They just have to go through like one big test to make sure that they're not harmful, and then they can do their work technically. I mean, they still technically have to do more modalities to like actually be able to like practice in a certain way. But so often these like holistic therapists get bashed because they didn't get a full like medical related, scientific related degree. But like the reason why so many people look up to these people and go to these people is because they practice based on lived experience, not even their own often. I have considered going into this profession because I was like, yo, I read a lot on all kinds of mental illnesses because psychology interests me. But I'm not made for a 10-year degree. But I'm definitely made for like reading and reading and reading on lived experiences and getting the baseline of like, you know, what you have to learn to be a holistic therapist. Like, an holistic therapist, by the way, they're not allowed to like treat like very intense illnesses like schizophrenia or something like that. Like, I feel like that's one of the biggest misconception coming from even studied psychologists. Like, how the hell do you not know that? Like, none of these people will treat someone with like a really, really intense mental illness. Like, there's so much ignorance within the psychology space, and like that's just based off of the people that I've gone to as like a client myself, and based on all the experiences I've read online. And of course, it doesn't have to be the baseline everywhere, but it is in a lot of places. It can't fucking fly that people go to like 8 different therapists in 10 years and have like mostly the same experiences that I'm talking about here right now. Like, can you're supposed to help heal people. How do you mess up this much? And I know a lot of people actually do this job so well. Like, of course, I see a lot of like really good like therapists and therapist stories online, and this is not going for everybody. And like, I don't ever want it to like make anyone feel like they shouldn't go and get professional help. Because, like I said, even exposure therapy helped me to a certain degree. Like, it's what kept me somewhat functional. It just isn't what made me like free from the anxiety, like the way I am now. Like, of course, you should seek professional help. You should try over and over again. But like, the therapy field should not be surprised when people self-diagnose, when people don't want to try anymore because they went like 2, 3, or 4 different therapists and all of them couldn't serve them the way they needed it. Like, you shouldn't be surprised that people don't trust your diagnoses anymore, because a lot of it is just like ignoring lived experiences. Like, of course, women are gonna like self-diagnose with ADHD when most research is for like as on little boys, and that only recently has changed. And there are no adult women ADHD specialists. Like, of course, people are gonna self-diagnose because it needs like literal years until you find a specialist that can actually assess you. And I think it's never a mistake to go like, yo, I have issues that are very similar to the lived experience of these people, and even if I don't have it, the tips that they give based on their lived experience, they might help me. And usually that's good. Like, what is so wrong about self-diagnosing, finding ways to cope with what you have, even if it's not the thing that you're self-diagnosed with? Please explain this to me. Like, of course, it's not good if you go around and tell everyone I have ADHD when you don't fully know that you have ADHD. But like, it's impossible to get assessed currently. Like, the next best person that is a specialist is like 100 or 150 kilometers away from me. Like, that is not cheap. Like, getting there is not cheap. And I don't even know if that person, like, I haven't double checked if that person is even specializing in adults or in children. Like, that is how hard it is. I'm in one of the richest Western countries in the world. Like, and you're getting mad at people for self-diagnosing when that literally could like save their life. Like, what the hell? That is so weird. Anyway, there's so much more I could like rant about here right now. But please, for heaven's sake, normalize actually checking the background of a person with anxiety disorder before you send them into exposure. Why is this so normal to just go, you have anxiety disorder, so now you need to face your fear regularly. We're not going to look for PTSD, ADHD, autism, or anything else that can cause anxiety disorder. Like, this is the most normal experience in all of these spaces that I just mentioned. Like, in the trauma related spaces, in ADHD related spaces, and in autism related spaces. This is like one of the main things that I read. That people were like, oh yeah, I was diagnosed with anxiety disorder and nobody looked deeper into this. That is so common. Some variation of that story is so common. I'm sorry, but that makes me angry. That makes me really angry. And I hope that changes in the next couple of years, because I definitely see like a shift into like a more holistic way to look at psychology, which should have been a thing earlier, but I mean, I guess it's great that it's done now, but it's not really done in my country. It's more of like in the US. I hope that comes to like my country too. I'm still in the search of an EMDR therapist, by the way. I really, really, really want to work on some stuff. Like, the thing is, I now, because I read so much on psychology, I have an even higher standard for a good therapist, because I know so many skills already. And finding someone that is on that level is almost impossible, because I feel like a lot of therapists just settle. I don't know, that's just the vibe that I'm getting. I know what exactly I want to work on and how I want to work on it. Like, I know, like, oh, I want to get EMDR for some stuff. Like, I want to try that. But I also know, like, oh yeah, what I want to like learn some like techniques and like unpack certain topics in a certain way that like I feel like would work the best for me. And I'm finding someone that fits into that the most is like almost impossible, especially if you don't have a car, so you have you're bound by like the public transport system. I wrote down a funny thing in the script for this episode. I mean, I mostly just wrote what I wanted to talk about, and like the script isn't really a script. It's just, oh yeah, this is what I want to talk about. But I wrote one full sentence at the end of it. And it's just telling a person with anxiety to just face the fear is as ineffective as telling a depressed person with executive dysfunction to simply do it. Amen to that. Like, you can't just like look at someone and just just do it. What? That also happened to me, like with like when I didn't tell a therapist yet that I had a lot of coping skills already. I still got the you should just like face the fear. That's the kind of stuff that makes me angry. But yeah, you get the idea why I'm mad, what I'm mad about, and what needs to be done better, and all the tangents. I hope they made sense. But yeah, share your thoughts on this with me on the social media linked in the show notes. And if you want me to go into like any of the topics that I kind of went into a little bit deeper, also let me know on the social media that I linked in the show notes. And until next week, stay safe and self-care. Bye!